So welcome back. Now, did you know that the body can make more structures as needed on the inside to help with cushioning and padding in various areas? One example of that is the bursa. Now, the bursa is a little sac of water that is located right around the joint and it lets muscles slide over it easier. We have about 150, 160 bursa, but the body can make more as needed. Now, when the bursa gets irritated, it is called a bursitis. And the most common places that this can get irritated in the body is at the elbows, the shoulder, around the hips, around the knees, and around the ankles. Another structure that can get also irritated in the body is called a tendon. Remember, those are those little ropes that connect the muscle to the bone. And when a tendon is irritated, it is called tendonitis. The most common places for the body for tendonitis is the wrist, the elbow, the shoulder, and around the ankle, and sometimes around the knee. These two problems can give patients swelling, sometimes a stiffness to hard to use the joint itself because of the structures around it being so irritated. Sometimes there is pain in addition to the swelling, but usually within a few weeks, this can go away. Now, the causes for these two things, bursitis and tendonitis, the most people will have what is called an overuse syndrome, where perhaps they walked or ran some more, or perhaps they were writing more and they irritated these structures. Overuse syndromes are not emergent. They are very slow to develop, kind of like one day is worse than the day before, and then they will usually plateau off. Now compare this to an infection, which happens in a few patients, and when a bursa or a tendon gets infected, now suddenly the patient will have symptoms that are worse hour by hour. They can get fevers, they can get chills, they can get redness. Now, way to treat these two diseases, well, one is prevention, if you can stretch before you exercise or do any activity. The second thing is to apply heat, to apply ice, and antibiotics if needed. The next thing is to take anti-inflammatories that will calm the swelling down, and pain medications if needed. Injections can also help. Again, injections are very helpful right before physical therapy because then the patient has less pain and less swelling, and they can do the exercises that the therapist is recommending. And finally, surgery can always be an option as well. So we have learned yet another amazing way that our body adjusts to things on the inside to help us function. As Superman would say, you are much stronger than you think you are. Until next time.